Good evening, everyone. My name is Rabbi David Warshaw. I'm the president of the National Council of Young Israel, and it's a pleasure to see all of you here this evening. I also want to acknowledge our co-hosts, the Rabbinical Council of America, the RCA, the Religious Zionists of America, Mizrahi, RZA, and the Igor Rabbanim as well. For the last 2.5 years, there's been one individual who has served as the guide, the medical advisor, the potake for our collective communities, and that is Rabbi Dr. Glatt. He needs no real introduction probably to any of us on the Zoom, and therefore, for the sake of time and so we can get the most from him, I'm going to turn the floor over to him right now. Rabbi Glatt, the floor is yours.
Thank you so much, Rabbi Warshaw. Can you hear me okay?
Yes.
Okay, good. So I thank the National Council of Young Israel, which Rabbi Warshaw has been so involved in, and since his assuming the presidency and really revitalizing this wonderful organization of Young Israel. Thank the RCA, the Igor Rabbanim, and all of the people involved in trying to put together a way that we can have the Yamim Noraim in as normal a way as possible. And that really will be the theme of tonight. It's quite a different world that we live in now, 2.5 years into COVID than it was at the start of COVID, but it's still not back to the way it was before COVID. But what we're all trying to do in as much of a halachic, medically safe and appropriate way is to get back to have normal religious rituals, normal social Jewish values being allowed to be continued and maintained, and for our children to be safe and to be able to grow up properly and not have restrictions that aren't necessary, restrictions that aren't required by halacha or by medical advice. And what I'm going to talk about tonight is a far more nuanced approach to what we need to do, and to stress that things are quite different, Baruch Hashem, all in a very positive way than they were when we started this pandemic. And unfortunately, as we've gone through so many losses of life and so many difficult situations, we have to really stop and thank and give tremendous hakaras hatov to HaKadosh Baruch Hu for allowing us to reach this point in time, which really is getting as close to normal as we could possibly ask for, considering everything that we've been through. I want to stress that we're entering into Zayin Ba'av, which is entering into the more severe level of Avelus that we encountered during this period of the 3 weeks, the 9 days, the Shua Shechalbo, the Zayin Ba'av, and then, of course, Tisha B'Av. And we have to remember the single most important thing about the 3 weeks is that if the Beis HaMikdash isn't rebuilt in our days, it's as if the Beis HaMikdash was destroyed in our days, which means HaKadosh Baruch Hu is watching us. I don't see him on the Zoom participants, but he's watching us. And he looks to see how we treat each other. He looks to see how we're acting one with the other when we have differences of opinion, when we have sometimes very stark disagreements as to what we should be doing. And we always remember, machlokis l'shem shamayim can still be a terrible machlokis if we don't treat each other with the proper respect. Beis Hillel, Beis Shammai were far apart on many, many halachic matters, but they treated each other with tremendous respect. And what I'm saying tonight is not Torah Misinai. It's my understanding of the medical facts and mine alone. And it is my discussions with my Rebbe, Rav Mordechai Willig Shlita, that I'm going to be saying anything psak halacha tonight. He's maskim to what I'm saying. And again, these aren't necessarily the only opinions for someone to follow. And I want to start off from the very start and say that the advice that I'm giving is just that. It's advice. It's advice that I'm giving today that is based upon the facts of today. I'm not a Navi. I don't know what will be by the Yamim Noraim. Assuming things aren't drastically different from a medical point of view, then the advice that I'm giving now should be appropriate for the Yamim Noraim. But everyone has to realize if there is a significant change, so then you can't say, well, Glatt said this, and therefore we're doing this no matter what. And just like nobody would be following the advice that we gave back in March of 2020 nowadays, so one shouldn't be following the advice from early August when we get to the Yamim Noraim in late September and October. So therefore, we really need to understand that this is a rapidly changing field and things can change, and new information doesn't mean that we were wrong based upon what we said previously. It meant that that information wasn't available. And as with psak halacha, medical advice is only as good as the time that it's given based upon the information that it's given. which is what HaKadosh Baruch Hu wants us to do. HaKadosh Baruch Hu wants us to follow the medical advice and then to go and base halachic decisions based upon the best expert medical advice. And I don't claim to be the only expert. I don't claim to have a lock on what is right and what is wrong. So these are my opinions. And I stress that every shul should have its own set of doctors, knowing their own community, knowing the concerns of their congregation, and then present that to their Rav. And the local Rav should be poskening and making the final determinations for every individual shul. We're blessed with Baruch Hashem, wonderful Rabbanim in every one of the shuls of the Young Israel, in every shul. That's a Shomer Torah Mitzvah shul. We have wonderful Rabbanim, and they, along with their local medical experts, are really the most capable and qualified to decide what should be the psak halacha for that shul. So what I'm saying is general, and any Rav, any shul president that wishes to ask me specific questions, I'm always happy to try and address them. But this is not the one answer, one size fits all, and that's the most important thing to start off with. And as I said, if you disagree with my opinions, you're certainly entitled to, if you're an expert, if you're a knowledgeable infectious disease physician or public health official, and you disagree with my interpretation, you have every right to do so. And we would respectfully disagree and continue to be wonderful members of Klal Yisrael together. It's unfortunate that at times the level of the conversation has been less than stellar. And that's the most important thing that I'm going to say again tonight, is that we have to have civility. We have to have a conversation. Even if we disagree with each other, it has to be a civil conversation, a conversation where after the conversation is done, we can still all daven Marav together, and we can still all be in the same shul, in the same building, in the same kehila, without there being terrible strife and terrible machlokas. So with that brief introduction, let's get into where we stand right now in terms of the facts of COVID-19 at this point in time. So the Omicron series of variants, starting off with the BA1 variant, which quickly changed to the BA2 and various subcategories of BA2, and now the BA5 is the predominant Omicron strain in the United States. I checked the stats from the CDC a short while ago today, and we're at about 86% of the strains in the United States are BA5 strains. So we're pretty much across all the different parts of the country. That's the stats for the United States. The stats for the world are not that much different. But across the United States, we're really running in all the different regions where all people might be listening to this, and all the different shuls across the wide span of shuls in the United States. So we're all dealing with, essentially at the present time, heavy predominance of BA5 Omicron strain in the communities. And this has led, because it's highly contagious, Baruch Hashem, it doesn't seem to be more virulent. That's not less virulent, but it's not more virulent, meaning it doesn't cause more severe disease, but it can cause severe disease just like the previous strains of COVID-19 could. So it is more contagious. So the most important thing to realize is that we are going to be seeing more COVID-19 in the United States. So that's a fact, and that's true even if you're vaccinated. That's true even if a person has natural immunity plus vaccination. Omicron, the BA5 strain in particular, about 8-9% of the strains are the BA4, and a couple of percent are the BA1.12.1 strain. So those are the three strains that we're really seeing now across the United States. And all of those strains are highly contagious, even for people that have been vaccinated and boosted. So it's critically important to understand that people will get infected, even though they're in the, quote, best immune situation that they could possibly be. This is true for younger people. This is true for older people. This is true for everybody. Now, Baruch Hashem, the most important and best thing that I can tell you is that people who are vaccinated with the primary series and at least one booster, and possibly two boosters, and certainly if they've also had COVID, especially if they have had COVID with one of the Omicron strains, are extremely unlikely to get very sick from getting Omicron right now. Meaning that right now across the United States, we are seeing a plateau in the number of patients that are being hospitalized. We have not seen a dramatic increase in the number of patients that have been admitted to ICUs. And Baruch Hashem, we've not seen a dramatic increase in the number of deaths. And the reasoning behind that is because people who have been vaccinated, and especially if they've been boosted, have Baruch Hashem Kemat hakol, almost all, have relatively mild disease. That doesn't mean that you're not going to feel sick. You're going to feel like you maybe have a bad cold. Some people have very minimal symptoms. Some people are totally asymptomatic. But the majority of people that do catch the BA5 strain right now will probably have mild disease. The overwhelming majority of them will not need hospitalization. And even those few that will need hospitalization will probably not require intensive care unit care, and b'li ayin hara will not succumb to the illness. There are always exceptions. The people that are at the highest risk previously remain at the highest risk now. And this is especially true in people that are in the older decades of life. I won't begin to define what older decades of life is, but I'll use what the CDC has a category of 75 years of age and up. And that group does have a higher risk, even if they're vaccinated and even if they're boosted, than if they were 50 years younger. So that's assuming that they have the same level of underlying medical problems, the same level of BMI, the same everything else. So a 25-year-old is going to do better than a 75-year-old. It's true in basketball most of the time, and it's true in life. As you get older, Baruch Hashem, you get a little grayer, you get a little wiser, you get a little bit more content with life, hopefully, but at the same time, you are at a greater risk. However, Baruch Hashem, that group still remains in an extremely low risk. So that's the basic medical information that everybody has to be aware of. The group of people that are unfortunately succumbing, even at this point in time, to COVID-19 are people that have not been vaccinated and boosted, and especially if they have underlying medical problems, and especially if they never had COVID previously. The deaths are occurring primarily in those individuals, not to say that there aren't some deaths in people that don't fall into those groups. There are unfortunately some people that will succumb to this, even though they've been vaccinated, and even though they've been boosted, and even though they may have even had COVID beforehand. But those deaths are few and far between. And if you also look at the different ethnic groups, so in the ethnic groups that most of us belong to, so in those ethnic groups, the rates are even better. So the likelihood of succumbing to illness in that group for various factors, usually related to vaccination and boosting, are going to be less of a concern for those individuals. And therefore, based upon those facts, some of the things that I'm going to say are going to be my recommendations in terms of how we deal with COVID for the Yamim Noraim. Anybody who has not been vaccinated at this point in time, I can only strongly recommend that they do so. They shouldn't wait till we come out with new Omicron-specific strains for the booster. That is a mistake if you haven't been vaccinated yet. The biggest question that I get asked, and the answer to that is not really fully known, is what should a person do who has had the primary series of the two mRNA vaccines? They got either two Modernas or two Pfizers. At this point, not much of a difference between them. And they got a booster dose. They got one booster dose. And the question is, they ask me now, should I get another vaccine now, or should I go and wait till the September, October, we don't know when, the more Omicron sensitive ones will be available. And those are expected to give you better immune protection against the Omicron strains. And my response to that is in the following manner. If a person has been vaccinated and has one booster and doesn't fall into the highest risk groups, they don't have underlying medical severe illness, they're not of an especially high BMI, they're not of an especially high age. So then the chances of them getting sick, being hospitalized, and Rahman al-Islam succumbing to COVID are extremely low. If you add to that they've also had COVID in the past, so natural immunity is certainly of great benefit. It's not as good as vaccination. Certainly the combination of natural immunity and vaccination is even better. And certainly in that group, if they don't fall into the highest risk groups, I think it's reasonable to say you can wait till the newer Omicron variant boosters come out. But if you fall into a higher risk group and you haven't had natural COVID, and it's been at least 4 to 6 months since you've been getting your first booster, In that group, I would probably recommend that they get a booster as soon as possible and not wait till September or October when the, quote, Omicron boosters will become available. And that's my opinion. One can disagree with it. The United States officially recommends that anybody above the age of 50 should get a second vaccine, a second booster after the primary series. I have no problems with people following that recommendation. I think it's a reasonable recommendation. I think it's also reasonable, if you're not in the highest risk group, to wait, if you haven't gotten that second booster yet, to wait till you get the newer Omicron variants. Certainly, if you haven't gotten the first booster, I would strongly recommend that you go out and get that right away. So that's roughly the state of the art where we are right now. There's one additional factor that I think is extremely important in terms of posketing for what to do for the Yamim Noraim, and that is that we today have very effective treatments for early COVID, which is something that we have not had previously. And this is critically important in terms of making the decision in terms of what we should or should not be doing as a community, which is totally different than what we had back in the start of this epidemic or at any point until relatively recently, when we didn't have treatments that would be successful against COVID. Today we have Paxlovid. Unfortunately, Paxlovid has bad press that is just totally incorrect. Everybody worries about the rebound effect. When Fauci got COVID, when President Biden got COVID, so everybody said that, oh, look at the rebound effect. So people who unfortunately don't look at the literature and just read the local newspaper will talk about Paxlovid rebound. But in published papers, it's clear that even those that aren't treated with Paxlovid get rebound. We understand that this is the natural history of COVID, especially with the Omicron variants. The people will sometimes, as President Biden did, become antigen negative when they do tests, and then they can become antigen positive again afterwards. That has nothing to do with Paxlovid. That has to do with the underlying illness. A preprint was just published yesterday, clearly demonstrating that. Probably the best, it's not fully published, but the best evidence that we have of what I'm saying is true was just put out as a preprint yesterday. But it was actually shown in the earliest studies looking at Paxlovid that clearly rebound occurs in patients not treated with Paxlovid. So for people not to take Paxlovid because they're concerned about this rebound effect is just incorrect, outright incorrect. Paxlovid is an excellent drug. It has certain medical contraindications with certain other medications, but otherwise, if you don't have a medical interaction with the drug that you're taking, so then Paxlovid is an excellent drug. Now, you should be asking your doctor about this. You shouldn't be taking this on your own. So if you do get COVID, it's extremely important to get tested to identify that you do have COVID if you have symptoms, and to ask your physician, should I be taking medication? Your physician should know that you should or should not be taking medication. For people at higher risk of progression, I strongly recommend taking Paxlovid, especially if there's no drug-drug interaction. There is the availability of other medications as well. They're not as good as Paxlovid, but they're alternatives, something called molnupiravir and possibly 3 days of intravenous remdesivir. But these are decisions your physician should be making. I'm not giving a medical grand rounds here, and I don't want to talk about specifics of the drugs, but those are 3 medications that you could possibly be taking if your physician and you are aware that you have new onset COVID and if you fall into a higher risk group. So even if everything that I said wasn't correct and you got COVID anyway, and it looks like you're beginning to get sicker, there are treatments available to modify and mitigate that. Paxlovid has a 90% success rate in preventing serious illness. So that's a great medication. Has bad press, but I can't help that. I can tell you it's a great medication. In addition, there is one monoclonal antibody, bevtelavimab, that is an excellent drug against the Omicron variants. It's the only one of the monoclonals that can be used to treat at this point in time. All of the other monoclonals don't seem to work against the Omicron variants. So this is, again, something that you need to discuss with your physician. At the present time, there is somewhat of a shortage of bevtelavimab, but it is expected that it's actually going to be available for purchase, meaning that it's not going to be given out for free anymore by the government, but there is expected to be a resupply of this in about a few weeks in all probability. And that is another alternative that will be available for people to go and be treated with. Again, these are all decisions that your physician should be making. I'm telling you the names of these drugs just to remind you that there are options, and that influences the psak halacha in terms of what we can do as shuls and what we can do as communities, because we now have effective therapies. And then Rahman al-Itzlan, even if these therapies don't prevent you from getting into the hospital, our rates of success in terms of getting people successfully, healthily out of the hospital are much better than they were at the height of COVID. So based upon all of this medical information, we can now come to discuss what we need to do for the Yamim Noraim. Now, for most people, and I discussed it with Rav Shlita, and he's masking to what I'm telling you right now, most people fall into the category at this point in time with COVID of what we call dosh bei rabin, what we call that most people are willing to accept the risk. There's always risk. There was risk with influenza. Most people didn't stay away from shul because of their concerns of getting influenza. Most people don't stay away from shul because of their concern of getting RSV or the concern of getting some other viral illness that could, in a very, 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 very small percentage of people, be Rahman al-Itzlan, very dangerous. For those patients who are extremely immunocompromised, they stayed away from shul back when influenza was the scourge and influenza was the concern. And they were the people that wore a mask 10 years ago. And they were the people that were in isolation even before COVID. And those people still will be at higher risk. And I believe it's the responsibility, if possible, of each shul to try to figure out a way that everybody, including those people that are at the highest risk, can try to daven tefillah b'tzibur. But we should remind everybody that Rav Shechter Shlita, as well as Rav Willig Shlita, have both said that if somebody is overly concerned about their health and going to shul, they are potter from tefillah b'tzibur. They don't have to go and daven in a minyan if they are in a really high-risk group, or they have the thought that they're in a very, very high-risk group. So that is their choice. In addition, masking still is effective in terms of preventing both spread as well as getting COVID. So even if you're the only one wearing a mask, so that still can be an effective way to decrease risk. Certainly davening in an outdoor minyan is a far, far lower risk than davening in a tightly packed indoor space with poor ventilation. So every shul is different. Every shul's capacities for both indoor and outdoor minyanim, for their optimizing of their HVAC systems and their optimizing the ventilation. Those are all things that I think should be done in every shul to the best of their ability. But those aren't the end all in terms of can a shul have an indoor minyan or not. And therefore, under most circumstances, it's my psak halacha, which was muskam to by Harav Willig Shlita in conversation that I had with him earlier today, that shuls can go about planning to have regular Yamim Noraim minyanim indoors if that's what the individuals in the shul feel comfortable with. For those individuals, which I would dare say from my very non-scientific survey of shuls that I've been in and from speaking with people, is probably the vast majority of shuls. If your shul doesn't fall into that category, if the medical experts in your shul are not comfortable with that medical advice, so then that shul has the right to go and make more stringent. But because a minority of the people in the shul feel that way, but the majority of the shul, with the haskama of the Rav and the medical experts of that shul, don't feel that way. So Harav Willig Shlita says that the minority don't have the right in this situation to force the majority to do something that the majority doesn't wish to do. Because again, of this principle of dosh bei rabim, because of the statistics that I put forward in terms of the lower, significantly, far, far lower risk of chas v'shalom dying of COVID today, even though some people are dying of COVID today. But since that risk group is a very specific and selected risk group, for the majority of people that don't fall into that risk group, they're not obligated at this point in time to go and not have the type of davening that they feel comfortable having, which is both medically and halachically sanctioned. And again, if you're, for example, davening in a senior citizen's home, a nursing home, and the people in that group are far older and they're far sicker and they have numerous other medical problems. So then that might be a different situation than if you're davening in a regular shul minyan, which has a whole variety of people of all different sizes and shapes and all different medical conditions and all different age groups. So the halachic psak that I'm giving at this point in time with the haskama of a Rav Willig Shlita is that shuls can plan on having regular Yamim Noraim davening in the way that we've been used to in the past, and try, as appropriate, to accommodate those congregants that can't or don't feel comfortable having that type of davening by maybe having a separate minyan for them, if possible, an outdoor minyan for them, for shuls that are capable of doing that, for the very high-risk groups, or to have a section in the shul which might be a mask section and a distance section for those people that feel very uncomfortable still. I would suggest that those people should probably be wearing an N95 mask rather than any of the other masks, or a very tight-fitting surgical mask, because that will provide additional benefit if they're indoors in an indoor setting. Again, in an outdoor setting, I think that it is in general safer, and for those that don't feel comfortable for their underlying medical risk factors, to go into an indoor setting. So if shuls have that capacity to have an outdoor minyan, so that's certainly reasonable. I don't think that we need to cut the davening. I never was a fan of dragging on the davening. I think the davening should be a beautiful davening. Each shul should have choices, if possible, for faster minyanim or chazanish minyanim, minyanim that are slower, say mila b'mila, maybe have less kvetching, maybe have less singing. I think each shul has to find what's best for the congregants in that shul. And there could be multiple minyanim in a single shul. Baruch Hashem, at our shul, we have many, many, many different minyanim and different styles to minyanim. This was pre-COVID, and people gravitated to the minyan that was the one that pulled at their heartstrings the most, and that's the way it should be. And I do recommend that people try to find the minyan that they feel comfortable with, and both from a medical and halachic point of view, they can daven tefillah b'tzibur in as normal a way as possible for these Yamim Noraim. I don't think we need to make any special accommodations for shofar blowing. I don't think we need to make special accommodations to cut the piyutim out or to cut singing out. But I think that there may be individuals that feel somewhat uncomfortable, and each shul should try as much as possible to go and have the all the people in their congregation to be as comfortable as possible. And that is something that the Rav in the local shul, as well as the individuals in the local shul who are knowledgeable, should try to work out with the administration in each shul to make sure that this is as safe as possible. Now, there were a number of questions that came in, which I've tried to answer already. Some of them that I haven't had a chance to go and answer are, do I think that attention should be paid to COVID-related vaccine injuries? More attention should be paid to them. So I think the answer to that is that a tremendous amount of attention has been paid to COVID vaccine-related injuries. We've identified very specific, very, very rare complications from these vaccines, and we have addressed them. I think the medical community should be tremendously rewarded by HaKadosh Baruch Hu for him giving us the chance to have these vaccines, which by the least aggressive numbers, by the most conservative numbers, have probably saved hundreds of thousands, if not millions of lives. That's saved lives. I don't know of a single medication, a single procedure, a single other intervention the physicians have made in the last 2 years compared to COVID vaccination that has saved more lives. That's including surgeries, that's including all sorts of bypass operations, that's including all sorts of diabetes medications. COVID vaccination has allowed us to get to the point where we are today in terms of having a relatively normal Yamim Noraim, Yetz Hashem, and having the vast, vast majority of people getting a mild illness if they get COVID and not getting Rahman al-Litzlan hospitalized and intubated and chas v'shalom worse. So I think that there's tremendous kudos that has to be given. Everybody loves to make fun of people in authority. Everybody loves to make fun of scientists. Everybody loves to make fun of poor Dr. Fauci. Everybody likes to make fun of the CDC. When in fact, they're human. They've made mistakes. They could have done better jobs, but none of them did anything malicious. I can guarantee you that. And sometimes the facts weren't there, and best guesses turned out to not be the best guesses in retrospect. But for anyone to say that we haven't paid attention and haven't learned from the mistakes that have been made and haven't learned from new data that's coming along. So I think that's just incorrect and not looking at the facts. So I do think that there is certainly room to disagree with some of the CDC recommendations at various points in time. But in general, vaccination has saved millions of lives across the world. And those people who have been vaccinated and Baruch Hashem have had mild episodes of COVID have really that to thank to a large extent. Now, I was asked about vaccination of toddlers. So again, this isn't a talk really for update on COVID, but I do believe that the recommendations in terms of vaccinating all age groups are appropriate. I do believe that the benefit of vaccinating people increases the older you are. And certainly the benefit of vaccination in younger children is there. The overwhelming benefit to the vaccines in every age group have been demonstrated to a certain extent, some more than others, but certainly the risk-benefit ratio favors vaccination in every age group, in my opinion, as well as the opinion of the Pediatric Infectious Disease Society, the Adult Infectious Disease Society, and all the experts at the CDC. So that's their best recommendation. Would I push as strongly to vaccinate an 8-month-old child as I would an 80-year-old child? So no, I would much more strongly push for the 80-year-old, but I do believe that it's appropriate for every age group that has been approved for the vaccination to get vaccinated. I do believe that mask wearing is reasonable for people that feel that they're at higher risk. And again, I do recommend that an N95 be worn, preferably, if not a good fitting, a tight fitting single surgical mask or possibly a double surgical mask for people that have bushy beards. So an N95 probably offers little additional benefit versus a surgical mask because you have a lot of air coming in underneath the mask. So maybe wearing 2 masks in that situation might give you a tighter fit. And then finally, the last question that I have here is for those people that are significantly immunocompromised and immunosuppressed. How can we ensure safe davening for them? So again, I'll reiterate, I do think that those people should come to shul if they're not so immunocompromised that their doctor tells them that they can't. If they do come to shul, I do believe that they should be wearing a mask, preferably an N95. They should be trying to sit separate from other people. Certainly anybody with any symptoms shouldn't be going to shul and shouldn't be sitting near them, because anybody with symptoms, unless they know that they don't have COVID, is potentially at risk for spreading the illness. We're taking some liberties in terms of easing restrictions and trying to have a normal Yamim Noraim, but we're certainly not recommending that people with known COVID or people that are still supposed to be in isolation go to shul. That is, I think, Isser Gomer. I think that's absolutely not allowed for somebody who's supposed to be in isolation to go to shul because it's the Yamim Noraim. So I do think that we can be safe for people by, especially outdoors, but even indoors, by trying to have more space apart, distance those people, and have them wear masks, and maybe have them be in a separate section. And in Yitz Hashem, they can also enjoy a safe and wonderfully spiritual davening in this manner. So those are the somewhat prepared marks and answers to the questions that I've gotten till now. So at this point, Rabbi Warshaw, are there additional questions that you'd like me to address?
There are a few questions that came through on the chat. I guess just as a little more specific follow-up to what you were just mentioning, what guidelines would you provide to people who have COVID shortly before Yom Tov regarding how long they should wait before returning to shul? And what about close contacts with people who are COVID positive?
Okay, great question. So anybody who has COVID should not go to shul, period. Absolutely. It's the yard site of their parent. It's Yom Kippur. Absolutely, I think, forbidden. Certainly no chiyuv. I think it's forbidden for them to go to shul if they're going to be potentially getting other people sick. That's not what HaKadosh Baruch Hu wants us to do. Now, when do they become no longer contagious? So the general rule of thumb is, for a vaccinated person, we expect that the likelihood of them being contagious after 5 days. Now, how do you count those 5 days? Day 1 of your symptoms is day 0. So when you start having symptoms, that's 0. The next day is day 1. The next day is day 2. So 5 days, 5 full days after the onset of your symptoms, if you have no fevers and you're not immunocompromised and you've been vaccinated, is the expectation is that you're probably, key word there, probably not contagious. So we allow those people to go back into society, but we do recommend that they wear a mask for the next 5 days, because probably after 10 days, you're going to get close into the high 90s, high 95, 98, 99% chance that they're not going to have contagiousness at that point in time. It's not 100%. If you want to wear a mask for a couple more days, that's certainly reasonable, but certainly 5 days at a minimum of being in isolation, and then an additional 5 days with a mask is what the CDC currently recommends. And we do have some data to support that, but again, the data is not perfect in that not every person read the book, and not every person is going to have the same viral load and the same clarity of when they become less contagious and no longer contagious. But I think the 5+5 rule, 5 days of absolute isolation and then 5 days of wearing a mask whenever you're indoors, is reasonable. Certainly, you shouldn't be going near other people that are immunocompromised in that setting. You should try to stay away from other people in that setting as much as possible. I wouldn't recommend that they go indoors except if it's something like Shul. There's no reason they should be going to indoor events at people's houses for social events during that next 5-day period of time. But I think for Shul, it's something that is reasonable. In terms of people that haven't been vaccinated, so then the recommendation is 10 days, really, that they shouldn't be going out. Now, there is a lack of clarity as to what happens if they haven't been vaccinated, but they've had prior COVID infection. And I would err on the side of assuming that they still are probably more contagious, because that's what the data does suggest. So then I would recommend 10 days of isolation in that specific setting. In terms of people that have been exposed to somebody with COVID, so if they've been vaccinated, the expectation is that they don't need to quarantine, but they should be careful, and they should probably wear a mask, because we don't know when they'll become symptomatic, and you're probably contagious in the 48-hour period of time before you become symptomatic. So let's say Mrs. Jones had COVID. Mr. Jones was exposed to it, but he feels fine, so he can go to Shul, but he should probably wear a mask. Again, it's not hard and fast, but it makes sense in that situation, especially if he's going to be indoors in a packed area. Is it absolute? No. Technically, they don't need to be in quarantine. They have been vaccinated, but they have been exposed. So again, I would ask the people, use common sense and figure out, certainly if they have any symptoms or any inkling that they're coming down with something, they shouldn't go out into indoor spaces because they are potentially contagious. I hope that answered the question.
Okay, thank you. How much time should elapse between the second booster and the fall Omicron booster? And how much time should elapse between a flu shot and the fall Omicron booster?
Okay, so I'll answer the second question easier because it's easier. You don't have to wait any period of time. You can get a COVID shot and a flu shot the same day, same time, probably use different arms, but that's about it. So COVID and flu can be given at the same time. In regards to how long you should wait, the current recommendation is to wait 4 months at a minimum after getting a COVID shot till you get your next COVID shot, assuming you need another COVID shot then. But there should be at least 4 months between boosters. If you didn't get vaccinated, then you don't wait 4 months, then get your second shot at either 3 or 4 weeks after your first shot, and then get a booster probably at some point down 4 months after that. So in general, the minimum time between boosters would be 4 months. And you probably can wait longer, as I'm recommending to some people right now, let's say who are due for a quote booster, but they're not in the highest risk groups and they want to wait till the better Omicron boosters come out in September, possibly, maybe October. So if they wish to wait that month or two till then, and they're not in the highest risk groups, they've been vaccinated, they've been boosted with one shot, and I tell them if they've had COVID recently, they certainly don't need to get a booster right now. If somebody's had COVID in the last 2-3 months or less, so it's as if they've been boosted. So they don't need another booster right away. And I would tell those people to certainly wait until the new boosters come out. Again, three vaccines plus COVID now is to me like having 4 boosters, four shots.
Should a 75-year-old plus person who has had 3 vaccinations but never had COVID get the 4th booster now or later? I think you may have spoken about that.
I think it's very reasonable to get it now. And don't worry that you're not getting the best, quote, booster, because I think it will help you. You fall into a high-risk group in that setting. At the same time, if you're not the type of person that is taking risks, You always wear a mask. You daven in an outdoor minyan. You don't go to a lot of indoor events. If you make the calculus that you're not really at high risk because of your activities, even though you may be at high risk from an immunological point of view, so then you might want to wait a month or two. I think that's also reasonable. But in general, most people are in a more social setting. Most people in that age group would probably benefit from getting a booster right now if it's been 4 months since they've had their last booster and they haven't had COVID.
Is a single J&J vaccine considered vaccinated?
At this point in time, I would recommend that that's not the ideal situation to be in. I would definitely get an mRNA vaccine now, unless there was some contraindication to doing so. If there is a contraindication to doing so, so then the Novavax vaccine now is available would be an option, or at least then to get another J&J shot, if not 2 more J&J shots over time.
Okay, and just to clarify the term vaccinated, does that mean 2 shots plus a booster or just the 2 initial shots?
I've been trying to, I hope I've been careful to say that the people who have vaccinated plus a booster, so vaccinated means they got the original primary 2-dose series of mRNA vaccines, either the Moderna or the Pfizer, and then they've gotten at least 1 additional dose, that's the booster quote, and then a second booster would be the 4th shot. Now, people also ask me, it wasn't asked tonight yet, should you switch? If you got Pfizer, should you get now the Moderna? If you got Moderna, should you get the Pfizer? And we don't know the answer to that. I think it's reasonable to switch if somebody wishes to. I think it's reasonable to take the same one if you wish to as well. I don't think we have data to support switching or not switching.
Okay, does the 90-day rule apply with respect to the OA5 variant?
So the 90-day rule was really based upon pre-Omicron variants, that you're very, very unlikely to get COVID a second time or a third time within 90 days of having your most recent episode of COVID. So that was, I think, pretty true. I would have probably stretched that to 6 months. It was very unusual for somebody to get a second episode of COVID, even within 6 months, if not longer, after their first episode of COVID. But that's no longer true with the Omicron variants. There are reported cases of people getting them within a month. Certainly the 90 days, I don't think it can be used in a way to say you're protected and don't worry about it, like we may have said in the past with the Delta or the Alpha or the original strains or any of the other variants that we had previously.
Okay, this will be the final question. If you had COVID 8 months ago and you're 75 years old with 1 booster, can you wait for the, quote, better booster?
So it's really unknown. I think it's reasonable if you're worried, if you go out into indoor spaces, if you have lots of grandchildren coming to you, it's reasonable to get the booster right now. I wouldn't wait to get the booster for that reason. But if you don't fall into the highest risk groups, either because of your activities of life or your underlying situation, so then it's also reasonable to say, I'll wait till September or October to get a second booster. No definitive answer. If you're scared or concerned, get it now.
Okay, this is a little bit of a different topic, but do you care to comment about the polio, I guess the polio case that was recently diagnosed in Rockland County?
Sure. So it's unfortunate. We haven't had polio in the United States in a long time. We still don't have polio in the United States. This was a oral polio complication of the vaccine, which unfortunately will occur in people that aren't vaccinated. If you've been vaccinated, and first of all, in the United States, we don't use the oral polio vaccine anymore, the OPV. We only use the IPV, and the IPV has 0 chance of that happening. But the oral polio vaccine uses a live polio virus. And while that oral polio vaccine in people of my age and older was life-saving, I was born right really at the end of the polio concern. But I have friends, and there are people that we all know that have had polio and that are unfortunately still suffering from that in terms of their being in a wheelchair or they're being with sequelae of polio. So this is a concern. And unfortunately, people that aren't vaccinated against polio will potentially be at risk for being exposed to polio whenever they travel anywhere in the world, because oral polio vaccine is still given out in many countries. So Again, I doubt that we're going to see a tremendous resurgence of polio, Baruch Hashem. But if we do see it, it will only be in unvaccinated people. Vaccinated people should not get polio, and they don't have anything to be concerned about. There is no reason that anybody who's been vaccinated should run out and get polio vaccine now. But if I wasn't vaccinated, I would run out and get polio vaccination now.
Okay, I guess I'll just take this last question that just came in. If you're immunocompromised and you've had both vaccines and both boosters, should you get a third booster?
So that's a very good question, actually. There are individuals that have not responded to 2, 3, and even 4 doses of the vaccine. And usually those are oncology patients. Those are usually very sick cancer patients or sometimes transplant patients. And they should discuss with their physician 2 options. One is to get a 5th dose or a 4th dose if they haven't gotten yet. And then there's another medication specifically that they can be considered for, which is Evusheld. Again, this is not a medical talk. These are the conversations that you should be having with your physician if you fall into that group to see if there is what we call a prophylactic monoclonal antibody infusion, which is different than the treatment, bevtelavimab monoclonal antibody infusion that we give for treatment. But there's a preventative therapy, a prophylactic therapy that can be given once every 6 months called Evusheld. And that may be an option for those patients that don't mount the response to vaccination because their immune system is so compromised. Many of those people will respond to the 3rd, the 4th, and possibly a 5th dose of the vaccine. And that's a reasonable thing for that very specific subgroup of patients to discuss with their physician. Is that appropriate or not? So either an additional dose of vaccine, a 4th or a 5th dose, with or without Evusheld, may be protective in that very specific risk group.
Okay, I want to thank Rabbi Glatt once again very much, Rabbi Dr. Glatt, very much for this presentation this evening. I'm sure everyone benefited greatly from it. I want to thank all of you for joining and to wish all of you a very meaningful and easy fast this Sunday, unless we will meet in Yerushalayim with coming Mashiach before.
Im Yetz Hashem, and Im Yetz Hashem, we should all be together in the Azara, packed into the Azara without mass this coming Yamim Noraim, and we should bask in the glory of the Shekhinah. Thank you all for listening. Yetz Hashem, we should have a wonderful, good gebencht year, healthy, good.
Amen. Thank you very much once again. Thank you. Thank you.